Good morning, everyone. So in this video today, we'll talk about amputation. There is not a lot of information on the amputation, but we'll just highlight and go over some of the things we need to know for NCLEX and for our class purpose. So with the amputation, we'll talk about the introduction, diagnosis, type of amputation, post-op care, phantom limb sensation, and the nursing care. Phantom limb sensation is something which we need to pay more attention to than other ones, but we'll go ahead and start the amputation. So what is amputation? It's the surgical removal of an extremity. It could be the upper or lower. Amputation is a traumatic event for anyone. There are several causes why we have amputation. It could be due to the thermal injury, tumor, osteomyelitis, which is an infection in the bone. It could be the congenital limb disorder. But for the most part, amputation occurs due to the PVD, which is your peripheral vascular disease with respect to the diabetes. We see the highest number of cause for the amputation is due to the PVD with respect to diabetes as a result of the diabetes. Now, when we talk about the diagnostic, there is not like one fixed test which we can do, but we can do a lot of studies that can give us an idea of underlying problem. What's causing it? What's the main problem? So the study include if it is infected, then we will do the white blood cell count. We can do several vascular studies such as arteriography, venography, which will just give us an idea about how the arteries that supply blood to that extremity is, how the vein that carry away the blood is, how it is working, and those kind of things. We also want to do the Doppler studies. Those are the things which will give us an idea about how the integrity of that extremity is. Now, amputation is a really good thing to help get rid of the part of the body which has been infected, which has not been working, but at the same time our goal is to preserve as much of a functional extremities as possible while still removing the infected pathological ischemic tissue. That's the surgical goal. When we talk about the amputation, there are two main type of amputation. You can have the closed amputation or you can have the disarticulation. Closed amputation is one and done. You create a weight-bearing residual limb and then try to fit the prosthetic afterwards, and it's done. With the disarticulation, on the other hand, this is the amputation through a joint that has been left open. They will go back and then later close it. It is done to control the infection. Now, with the post-op care after the amputation, we have to use a different kind of prosthetic. We can use the immediate prosthetic, but with the immediate prosthetic, we need to check for the hemorrhage. If it is bleeding, then you need to have the tourniquet available right at the moment. You can also have the delayed prosthetic, which is fitted after the healing. These are still temporary for the partial weight bearing. And then you can have the permanent weight prosthetic, which is given 3 months after the amputation if there is no apparent problem or the visible problem. Now, there are also the other things such as non-prosthetic, which includes the wheelchair and other kind of things other than the prosthetics. Now, the most important topic on this chapter is your phantom limb sensation. It's the shooting, burning, crushing pain and the feeling of coldness, heaviness, cramping in the extremities that is no more available there. They may subsidize or it could be chronic. One of the best way to reduce the phantom limb sensation is the mirror therapy that just gives the brain an idea that the leg is not there anymore, and it just makes the brain adapted to the situation. So mirror therapy is one of the best way to reduce the phantom limb sensation pain. Sorry. Nursing care wise, you want to make sure that the patient is ambulating. If there is prosthetic, it has to be fitted perfectly fine. You also want to give the emotional support because losing a limb is not a joke. It's really stressful for anyone. Now, while considering the nautical consideration, we want to make sure that we set the goals pre-op and post-op that is realistic, that is attainable. And those are some of the things we had on the amputation. Let's practice one question which will give us idea of how the NCLEX would like to test us on. A patient who underwent a below the knee amputation is experiencing the phantom limb pain. Which of the following is an appropriate nursing intervention to help manage this condition? Reassure the patient that the pain will disappear in a few days. No, you don't want to give that. That's a false hope. Encourage the patient to ignore the sensation as it will go away. Nope, you never tell the patient, just ignore it. Administer pain medication and discuss possible use of mirror therapy. That sounds a good idea. Offer distraction techniques such as the watching television to avoid thinking about the pain. Well, yes, that's one of the way you want to do it, but at this case, phantom limb pain is still a real pain, and the best way to treat it is treat it like any other pain. Give them the pain meds, and for the long term, give them the mirror therapy that will adapt their brain that the limb is not there anymore, and will give an idea of not about the brain that the pain is not coming from the extremities, that's no more. So mirror therapy, pain medication is the best one. All right, that's all we had in the amputation. We will discuss more in the other video. Thank you.